obesity and type 2 diabetes. Babies exposed to maternal diabetes in utero may have a higher risk of obesity and type 2 diabetes later in life, due to programming effects on metabolism and insulin sensitivity. Hypocalcemia. Babies born to mothers with diabetes may have low levels of calcium in their blood, which can lead to seizures if not promptly treated. Respiratory distress syndrome, RDS. Babies born to mothers with diabetes may have immature lung development, leading to respiratory distress syndrome, which can require special care and treatment after birth. Hypoglycemia. Babies born to mothers with diabetes may experience low blood sugar levels, hypoglycemia, shortly after birth, as their own insulin production ramps up in response to the sudden drop in blood sugar levels after delivery. Birth defects. Poorly controlled diabetes during pregnancy increases the risk of birth defects, particularly affecting the heart, spine, and brain. This risk is higher in the first trimester when the baby's organs are developing.
Diabetes during pregnancy, whether it's pre-existing, type 1 or type 2, or develops during pregnancy, gestational diabetes, can have significant effects on the fetus. Here are some potential impacts. Macrosomia. High blood sugar levels in the mother can lead to excessive growth of the fetus, a condition known as macrosomia.